as you can recall, we were able to show this a number of years ago, but it was only in 2020 that we really had enough families that we could study this and really characterize the disorder. And so working again with Dr. Zivna, we were able to identify 111 individuals from 30 families. And it was just truly an international effort. We asked many of our friends, collaborators from all over the world in rare inherited kidney disease, and they worked with us to identify these families and provide us information. We were able to show that patients with a signal peptide disorder or the prosegment disorder presented early in life, usually before age 20, many before age 5, with anemia, hyperkalemia, and chronic kidney disease. But we were also able to identify individuals with mutations in the mature renin peptide. And these patients presented later in life at an age greater than 20. And they started dialysis at a mean age, or needed a transplant at a mean age of 64. And we had gotten this idea from work by Dr. Celine Schaefer and Luca Rampoldi, who had previously identified a family with this mature renin mutation. Now, if we look at our patients in this cohort, and you can look at the graph on the left, the green points represent patients with signal peptide mutations, the red are prosegment mutations, and the black are mature renin mutations. If you look all the way over on the graph at the age 0 to 1, so all the way to the left, you can see that there are many green data points with children with GFRs between 18 and 75, often at the level of 30 or 40. And so we would have anticipated that these children might go on dialysis or need a transplant by age 10. However, if you look down at the y-axis at a level of 10, so we gave a GFR of 10 for every patient when they started dialysis. You can see only one patient, the red dot, started dialysis at 15, but most patients did not require renal replacement therapy till after age 30. So this was really great for our families and patients, because when they were diagnosed, there was really a lot of concern that they may need renal replacement therapy early in life, and this helped them to deal with their disease. So this slide gives us an idea, an overview of what happens in a rare disease and how the disease process works. So in 2002, we had one patient, and at this time, this mutation would have been a variant of undetermined significance. And we desperately needed to find another family to identify the gene. This was done by Dr. Zivna's group in 2009. And so now we had two families. We could really say that it looked like renin mutations could cause ADTKD. However, we had limited clinical characterization, right? We only had information on two families. Over the next several years, other families were reported, and this gave us more information. And so in 2010, we had confirmatory reports, and we also had the identification of a milder variant of the disease. Now, this is a really critical time in the study of rare diseases, because most of these genetic causes of kidney disease are identified by geneticists, and they do really great work with genetics, and they then may move on to another disease. And so you may have a stalling here until someone else picks up this disease or does something with it. And it's really important to have what I call a disease champion at this stage, a clinician and a basic scientist who are interested in research in this area and keep moving forward to classify the disease. And so fortunately, Dr. Zivna and Dr. Kamal and I were really interested in these patients, and we were able to keep working together. In 2020, we were able to publish a case series. And this allowed us to see more of the breadth of disease. And so this is similar with other diseases where we initially have this genetic characterization that we're still learning about the disease, may not know everything about it, but then we identify mutations that may be more or less important or more or less severe. And it was only in 2020 that we really had a name for the disease, ADTKD-REN. In 2021, now in 2022, these became part of gene panels. And so now we get called about different variants in the gene, and we're able to identify these variants as benign or causative. So you can see we're learning as time goes by and as we find more families. Now, larger cohort studies will be needed to find biomarkers and predictors, and then someday we hope to do an interventional trial. We think fludrocortisone works for these patients, but it's so difficult to test because we don't have enough patients to do a randomized study. So you can see in our disease, as in other diseases, at what stage the patient enters into the learning process of the disease is really critical.